champion physiotherapist, I must say. Very, very, very proactive in the field of physical fitness, especially for the elderly. She has got a very good understanding of how to direct older women for exercise, even women with osteopenia and osteoporosis, how they can, protect their bones, muscles, ligaments, and tendons and still perform the best. That is how I have understood Arti's work. Thank you for being here, Arti. You have qualified from Mumbai, 40 years of experience as a musculoskeletal physiotherapist, and clinical physiotherapy for the older women is your passion. You run classes for fitness for above 50 years. So you are just the medicine we want today. And you will be speaking on the do's and don'ts of exercise in osteoarthritis knee, and rather you would be demonstrating. The floor is all yours, Arti. Thank you so much.
Good morning, everybody. Am I
Good
clear?
morning. Good
Yes.
morning.
I want to wake up everybody. I'm sure with that lovely session that we had, we were on a mental mode and we are suddenly going into a physical mode now. You know, the mode is going to be changed slightly. And if possible, I would like all of you all to join me because I'm very particular about just teaching a few exercises to all of you all, because we as clinicians, I think we hardly find time to look after ourselves. This is what I keep telling most of the people. We are so busy, and especially you, your society is extremely busy. And I see Shobha, she sends me messages at 2 o'clock in the night, middle of the night. So that means she's working very hard. Let me start with saying thank you to Dr. Pushpa Sethi and to Dr. Arti Gupta, the president and the secretary, for inviting me to be part of this program. I'm extremely happy to be part of that. As I said, after such a lovely lecture, I really don't know where to start, but I'm just going to start from whatever is possible. All of us know what is osteoarthritis. It's basically a degenerative wear and tear, as it's called in our language when we are talking to patients, wearing out of the cartilage. Now, because of the wearing out of the cartilage, the most important thing that they have is pain, inflammation, stiffness, and there are certain deformities that can occur with it. So it can be a varus, it can be a valgus, it can be a fixed flexion deformity. Now, I highlight on this fixed flexion deformity because it is something that people tend to sort of overlook, more importantly. Now, the most important recommendation for osteoarthritis is going to either an orthopedic surgeon or a physiotherapist. And I, being physiotherapist, I would say, please go to a physiotherapist. So the most important is exercises are recommended for this. Now, what have I found in my practice? Osteoarthritis is one of the important aspects in my profession, and I see this day in and day out. Now, osteoarthritis can, to a great extent, when it is caught in the beginning, it can be cured, endured by exercising. So go to a physiotherapist if you have any knee pain, get it examined, get it assessed, look at the muscle power, and then start the exercises as soon as possible. Now, Shobha also told me that I should highlight the do's and don'ts. So I'm just going to, in short, look at the do's. Look at the don'ts first, and then we go to the do's. First of all, there is a lot of research to show that most important problems we find with exercising is people don't like to do it. They do it for some time. Once the pain goes away, they'll say, okay, chala gaya. So it's okay. Abhi chalo, band kar denge exercise. So adherence to exercise is something that is very important. So that is where I have noticed that if we can have a group exercise program, you interact, there's a social interaction, plus there is physical exercise that is going on. And I have found that women basically like to come together as a group and then do the exercise. So this is one of the recommendations that I have. If you can join in for a group exercise, nothing like it, instead of just trying to do one-on-one exercise program. Now, what are the don'ts? Remember, when you have extreme pain in your knee joint, please do not push your knee joint. Don't try to do more than 10 times repetitions or 5 times repetitions. If your pain continues even after 2 hours after exercising, that exercise needs to be slowed down slightly. That is the most important thing. The other important thing is, do not push your knee a lot when you have a lot of inflammation and pain, because you're going to inflame the joint a little more and your pain can increase. So do not, I repeat it, do not do high impact exercises. Now, osteoarthritis can increase when you have a high impact. Now, what do I mean by high impact? High impact is squats with weights, with dumbbells on your back, very important. Then burpees, going down into a squat position and coming up. And running with a high speed, trying to be a marathon runner when your knee is paining a lot or you have been diagnosed with osteoarthritis. Now, the other important thing that I really want to say is, people are becoming a little overdoing this running business. So please, even if you want to run, let it be a slow or a fast walk on a mud ground. The impact of a cement floor on your knee joint is extremely high. So these are some of the things that people cannot do when you have osteoarthritis of the knee. Now, what are the do's that we are going to do? Convert yourself into exercises which are low impact. What are low impact exercises? Aqua aerobics. Get into a swimming pool, get into a pool, get into water, go into, if you are near a seashore, get into water. Please do exercises inside your water. Water has this greatest quality about being buoyant. So it gives buoyancy to your limbs so that your muscles do not get tired and your knee starts behaving in a better fashion. It is extremely important to understand that. So the most important do is get into aqua aerobics. Cycling is a very safe exercise for all of you all to do. Anybody who has osteoarthritis do. The third most important is start working on slow exercises. Start with the exercises that I'm going to show. You can start with them, but you start doing those exercises at a slow pace. Start with, say, about 10 minutes of exercising and then slowly increase it. Today, I'm going to show some exercises for you all with something that's called as CLX. But do not start immediately when you have severe joint inflammation, when you have pain. Do not start with those exercises immediately. Start with free exercises and then convert yourself to resisted exercises. So it is important. Then you can do simple walking. Walking on a mud ground is extremely good. No problem. These are exercises which are not going to harm you in any way. Now, since we are really short of time, I'm just going to really go immediately into exercise program. Two things that I want to start before I say anything to you further is, you have to look at two deformities, varum and valgum. Varum is bow legs, which we normally see in osteoarthritis, and valgus is knock knees. Now, with the knock knees, what is associated is a flat foot. So just by looking at the knee, it is not enough. I will also show you some exercises for flat feet, because the whole line of weight bearing changes with flat feet. So basically, I'm just going to show you some simple exercises. And if you people, do you think that you can do some exercises along with me, I'll be extremely happy. Now, exercises, the important other point that I really want to touch is, lot of people do yoga. Now, if you're doing Vajrasana, if you're doing Padmasana, if you're doing the Surya Namaskaras, that is going to be bad for the knee joint whenever your knee joint is inflamed or painful. If you have osteoarthritis, my advice to you is avoid Vajrasana, avoid Padmasana, avoid doing the dog position or the Surya Namaskaras, because there are a lot of patients who suddenly come and tell me, yesterday was this particular festival. I have done 108 of Surya Namaskaras and they are not able to work also after that. So remember, it is how these movements have to be avoided. Tai Chi. Tai Chi is absolutely doable exercise because it is a slow movement pivoting. You're not going to do any harm to it. Elliptical cycling is extremely good. Swimming is very good. I repeat, walking is very good. Water aerobics is extremely important. How do you start? Always remember, if you strengthen your muscles, the muscles are the one which are going to protect the knee joint. The muscles are the one which are going to give stability to the knee joint more important. Sorry. As you're going further, what happens is with osteoarthritis, the ligaments tend to become lax. If the ligaments lax, what takes over the joint stability? It is proprioception and it is strengthening. So I'm going to show you some proprioception, some strengthening exercises. So all of us, if you all can possibly stand up, I would be happy and I would show you some exercises. So I'm just going to adjust the monitor a little now. So the most important is I have weights. You can use weights. The same exercises which I'm going to show can be done either with weights or with what I call a CLX. CLX is a consecutive loop exercise. The advantage with CLX is that we can do exercises even for our hands without attaching it in any way. But there are also exercises which they improve co-contraction. Co-contraction of the muscle means your flexors of the leg of the right leg are contracting, but your extensors of the opposite leg are contracting. So you give stability to your joint more importantly. And that is the advantage which you have if you do with a CLX band. So I'm just going to show you the exercise. If you think you do not have enough balance, then you can take the help of a chair. Chair here. Start, can you all see me clearly? Yes, just put your thumbs up. Right. Okay. So what we are going to do is we're just going to the first exercise is going to be standing on your toes. Remember, when you stand on your toes, you're going to be contracting all your muscles. You're going to be tightening all the muscles. The tightening should start occurring from here, from your hips. It's going to be up, down, up, and down. Up and down. So that is the first exercise that you're going to start with. Since I'm going to demonstrate the CLX, I'm just going to put on the CLX band. So this is going to offer resistance to me. What I'm going to do is I'm just going to take a mind support, one finger support here, and I'm going to do abduction. So I'm going to take it out. Try to maintain your core. So just contract your muscle in slightly and then take it out. So this is going to be one. And then you're going to take it forward so you improve your flexor. If you have a CLX with you, then you realize my left leg is also contracting as I'm working my right leg. So this is one. Then take it behind. Take it behind and up. Okay, these are the simple exercises in standing that I have shown. And we can also improve our proprioception. And the proprioception can be improved. This is called as a soft pad. I have a soft pad here, and I'm going to stand on it. And I'm going to put one leg. That's going to improve and then I'm just going to move the leg. I'm balancing myself, but I'm improving all the proprioceptive receptors around my knee joint, my hip joint, my ankle joint. So I'm improving all the joints and doing a lot of co-contraction. So I move it the way I want to move it. The way I want to move it, I can do that. And if you do not have a soft pad, then pile up 2 pillows and stand on 2 pillows. You will become a little shaky like this, and that is exactly what I want, because I want to improve the proprioceptors, and that is going to stimulate them. So this is one form of exercising that we are doing. Now I'm going to go down on the floor and I will show you the exercises. So we go down on the floor. Now remember, I talked to you about something that is called as a fixed flexion deformity. That means your knee remains like this. It doesn't touch the floor completely. So what has happened is the posterior capsule and the hamstrings become tight. So what we are going to do now is we are going to stretch the hamstrings. The best way to stretch hamstrings by yourself is go into a sideline position and stretch it forward. Pull your ankle towards you. I repeat, forward. Pull your ankle towards you. You will feel a constant stretch behind the knee, stretching your hamstrings. Now I'll show you what we call as static quadriceps, which is a high favorite of all the doctors. So we just take a small roll like this, put it below the knee, press, release. Press the towel down so that you stimulate the quadriceps to contract. This is one muscle which needs to be strengthened, and research says this muscle is very important for the knee joint. Press, press, and then the next one is up, up, across, across, up, up, up. Then turn to the side, and you want an action of the glute speeds. You turn to the side, take it behind, up, up, stomach, up, up, and then bend, bend. So these are the exercises that you will do in lying down position. Include the standing also. Now I will show you some exercises for your feet if you have flat feet or a pronated foot. Now, one thing I want to mention is the CLX comes in different resistance forms. So if you think the green is easy for you, then you can go to the next color, and this offers resistance. The advantage of CLX is that you can just carry it. You have a free OPD, just quickly do your exercises, then you're ready for the next patient. Now I'll show you some exercises for your feet, for a flat foot, because that's very important to tackle in osteoarthritis of the knee. So you take a towel, You take a towel, sit at the edge of the chair, and bring it close. Bring it close. I'm sorry, because the rubbers. Bring it close. Pick it up. Pick it up. Just pick it up. Shows my muscles are weak. And then try to lift it up, down, up, down, and walk on your laterals. Walk on the lateral surfaces. That's very important. Walk on your toes. Walk on your toes. Walk on your heels. All this is going to improve walking your small muscles of the leg. So these are some of the exercises that I would like whoever has osteoarthritis of the knee joint to start off with. So as I said, proprioception, strengthening, flexibility. Most important, stretches also have to be included in it. So you can do an IT band stretch. You can do a piriformis stretch, which I have not shown. You can do a quadriceps stretch. These are all a must. So you will be spending about a half an hour session for yourself when you start doing the exercises.